Definitely plan.
Okay, today is Monday. I believe March 31st, not sure, but got bored. My hair was itching, it was napping. It's gone. I didn't mean to cut this part this short. I kind of made it be would have left it this much, but nevertheless, it's gone. So
we are having and will continue to have, and what we're doing to prepare for the
we're gonna try to stay real brief today.
We've said from the very beginning, we knew that our vulnerable populations, not only consisting of our elderly, but also those who were living in congregate settings and sadly
so I just can't use that one. Let me move on.
Would also be considered a part of that vulnerable population, and so we would have to move quickly to make sure that in places where we have single room occupancy hotels, where our shelter systems are, and places like Laguna Honda, which house a significant population of elderly patients, we had a plan and we were going to keep people safe. From the very beginning, we knew this would be a challenge. And many of you have heard about some of the recent information of staff members being tested and coming back positive in Laguna Honda. And since then, we've been taking a number of steps in order to test others who might have been in contact with those individuals. And thus far, what we have learned is 9 employees of Laguna Honda Hospital have tested positive, as well as 2 patients. And we are still testing people at Laguna Honda Hospital, and we'll have more information about the specifics once those test results come in, and Dr. Colfax will provide some more details as well. We knew the situation would be challenging, and so immediately last week, I sent a letter to the Federal Department of Human Services asking for significant support so that we could not only focus on making sure we provide the resources and support to this hospital and we don't continue to drain other services, but we have the expertise and the testing on site and the other things that are needed in order to prevent something from happening that we know has happened in other places throughout the country, including in Washington, that house a significant population of elderly patients. Laguna Honda is one of the largest hospitals of its kind anywhere in the country, housing over 750 very, very vulnerable residents who cannot take care of themselves. And this is basically their home. And
all right, even as San Francisco Mayor London Breed continues to hold her live news conference, California Governor Gavin Newsom is also starting to speak. So let's listen to his message for the state.
Today, we are announcing a new effort, healthcore.ca.gov, healthcore.ca.gov, that will provide a platform to match individuals that may have retired in the last 5 years, may be in the process of getting licensed or relicensed, people that are in nursing schools or medical schools that are nearing the completion of those efforts, to incorporate and encourage them to get on this platform to provide for the kind of human capital surge that we'll need to meet the moment over the course of the next number of weeks as these numbers continue to rise. We couldn't be more pleased by the incredible professionalism of our nurses and doctors, our professional representatives that came together across many differences and organized around a framework of providing more flexibility, more surge capacity within the system, by providing scope of practice reforms, by allowing us to utilize our existing resources in a more resourceful way. I want to thank all of the representatives for putting aside, again, those differences and meeting this moment head on to provide the flexibility that is required to meet this moment. We have an executive order that went out that will provide flexibility through June 30th. This is temporary flexibility on staffing ratios, on scope of practice for nurse practitioners, EMTs, and others. We are going out now to deeply find the kind of talent, though, that is necessary beyond the scope of practice changes and beyond the regulatory changes, and to make sure that we have the adequate workforce, looking for mental health experts, looking for more EMTs, more pharmacists, looking for more phlebotomists, looking for more experts in respiratory care and the like, technicians, administrators, doctors, nurses. We are calling on you to step up and step in and meet this moment. We have more licensed healthcare professionals in the state of California than any state in the nation, some 766,000 professionals in the state of California. But we estimate we have the capacity to increase our ranks by an additional 37,000 plus professionals that are in that time of life where they again may have just recently retired, or they're in the process of getting their license and their degrees. And so we are very, very hopeful with this effort that we will see a surge of individuals to be paid and compensated to participate in the workforce and distributed throughout our care delivery system all around the state of California. I will have an individual and representative here in a moment to talk more specifically about what that means, and also remind everybody it's National Doctors Day in the United States of America. And again, just deep respect and admiration for all of our frontline employees for meeting this moment. I also want to express deep respect and admiration to Mark Zuckerberg and Facebook, well aware of the need to surge with our healthcare capacity. They are providing stipends for individuals that need transportation funding, that need childcare support, if they're going to participate in this workforce, that can get the kind of support on things that otherwise we wouldn't be paying for. Things not just like childcare and transportation, things like hospital, or rather hotel rooms and accommodations. So they put up $25 million, and we're very grateful to Facebook for providing those stipends to help us in areas where we need a little bit extra support. Again, that's the spirit of California. That's the spirit of this moment. It's the spirit that's driving our resolve. Driving that resolve as well is the aggregation of all of these physical assets that have taken place and shape over the course of the last few weeks. From the USNS Mercy that now took their first patients just yesterday in Los Angeles, to the 2,000 rooms that will be surging from the support of the federal government, these field medical stations. We already have our Santa Clara operation up and running. We have Riverside up and running. We have work being done in Los Angeles and San Mateo that will share some of that surge in San Francisco, part of the FMS process. Again, already operationalized. Seton Hospital, already operationalized, that we brought into the portfolio of assets here in the state. We've been talking over the weekend to get St. Vincent, 366 beds in Los Angeles, fully staffed up as well. And we'll have some specific announcements on that in the next few days. Community Hospital down in Long Beach, we're starting to see that all take shape in real time. We have other hospitals we've identified in addition to the FMS sites in the USNS Mercy. We are also looking to get some 1,000 skilled nursing facility units up and running, and we have indeed made real progress in other areas from Fairview, Porterville, and now working with the Army Corps of Engineers that has now looked at 15 high priority sites. They've got 4 more that they'll be looking at, from the Sleep Train Center here in Sacramento to Oakland Coliseum, to the LA Coliseum, and other sites throughout the state of California, looking at those sites as potential surge sites, all part of the plan to increase by 50,000 beds our available capacity within our healthcare delivery system. We have distributed now some 32.6 million N95 masks in the state of California. We have our sights on getting that 101 million that we have locked up into the state. Every couple days, more of that PPE comes in, not just N95 masks, but coveralls and shields and gowns and gloves, glove sets and the like. And so as soon as we get them in, we get them out. Yesterday, we were getting in a number of ventilators into Bloom Energy for refurbishing and reconfiguration. I'm very pleased the 150 that came from LA as part of the national stockpile, all of those have been completed and are done and are being sent back out into LA County. And I just want to encourage folks, if you have a line on ventilators, it doesn't matter if they're brand new. Maybe you have a few pieces lying around your basement of the house. I don't mean to be flippant. We'll take them. We've got the folks here in Silicon Valley that can do miracles with old equipment and refurbish that equipment. I just mentioned a few days ago that our community college system, they found 192 ventilators, not all of them in perfect shape. Some of them used for training and the like, but we'll take whatever we can get. We currently have 4,252 ventilators that we've locked down. Our goal is to get to 10,000 ventilators. We're looking to procure new ones from around the globe, and we're hopeful that the federal government can assist us beyond the 170 that came into LA County, but if they don't, we'll be as resourceful as we possibly can. So on the physical asset side, that surge of 50,000 beds, we're making real progress. On PPE and lining up and identifying those needs, we're making progress, but still more needs to be done. But as it relates to personnel and people, nothing more valuable and nothing more potent to meet this moment. And so if you're a nursing school student, a medical school student, we need you. If you've just retired in the last few years, we need you. If you are looking to expand your scope of practice and have particular expertise in any particular capacity, we need you, and we encourage you to take a look at that healthcorps.ca.gov website. 5 simple steps. We'll ask you basic questions, and we'll help you with your relicensing. We'll help you with the protocols and processes to get you up and running and get you out the door so that you can support the needs of people in the state of California all throughout our state. We've seen an increase, a modest 8.3% in terms of total number of positives last night, 5,763 total COVID-19 positives in the state of California. But it's those hospitalization numbers, it's those ICU numbers that we are most focused on. And again, those numbers are starting to go back up again along the lines of our model. So the next few weeks are going to be critical in the state of California. The next few weeks, we're going to need more to flex and to surge and do more together to meet this moment. And before I turn it over to the doctor, I want to just remind people of how they can meet this moment. All of you that have the capacity to contribute can contribute most significantly by practicing physical distancing, by continuing the good work that we've done in the state, including over this weekend. We had to shut down all 280 parking lots in our state parks system. We saw a reduction in the kind of surge of activity in our parks and in our beaches compared to the previous weekend, but we want you to continue to do that. There's nothing more potent and powerful in terms of meeting this moment than practicing that physical distancing. Socially connected, let's be resourceful in addressing the needs of others. And I couldn't be more proud of our partnership with Nextdoor and the volunteers, some 8 million people they were able to connect with, to check in on our seniors, to check in on people that are struggling with social isolation and may need not just food and medicine, but also may need a person to call, just check in and see how they're doing. So nothing more important for individuals, if they want to contribute in this moment, that continue to do the incredible work you have done in the nation's largest state to practice physical distancing. Number 2, I just want to remind people that if you know anybody in the medical profession, if you know people that you think are willing to contribute their time and energy in a compensated way, to go to this new website so we can meet the healthcare surge as well. So partners, well, across the spectrum, private sector, Facebook, the public sector, with the incredible contributions of nonprofits and civic-minded individuals, will continue to row in the same direction, continue to meet this moment as we have in the state of California. In addition, and I'm happy to answer questions, we are significantly increasing our efforts on homelessness. I'm happy to go into details around that, but I want to now turn it over to Dr. Constant, who has been part of our partnership with the California Medical Association, working across the spectrum of healthcare professionals that helped us with guidance and was willing to, again, work with us to create the flexibility, to create the kind of licensing reforms that temporarily are needed to meet this moment. And I just want to thank Dr. Constant for that effort and her energy, and ask her to come to the podium and talk a little bit more about what we're looking for on the medical side for this surge. Dr.
Thank you. First, I wanted to take this moment to thank Governor Newsom and California's public health leaders for the swift action that they've had in terms of our physical distancing and our sheltering in place, because it is really helping the healthcare team. It's helping us. The time has really been crucial to help us learn about this new virus as healthcare providers, how best to treat it, and how to create the systems of care so that we're there and ready for the sickest when they need us. Today is National Doctors Day, and I want to first extend my heartfelt gratitude to all my physician colleagues, as well as everyone in the healthcare world taking care of our patients, for your vital service at this time for both our patients and our communities. This crisis is already impacting thousands of physicians across California, not just those who are directly taking care of COVID-19 patients, but also the thousands of others whose practices have been forced to close over the past several weeks. But even amidst this uncertainty and personal hardship, over 500 physicians have reached out to the California Medical Association to ask how can they help during this time. Either directly treating the sickest patients or stepping in to help fill in the gaps for the people that are taking care of our sickest patients. In fact, all members of our healthcare team are showing tremendous courage and bravery, continuing to treat patients even though they worry about the personal protection equipment that they need to keep them safe. I am very grateful to Governor Newsom for his intense focus on delivering the personal protective equipment to our workers who are on the front lines of this pandemic, to ensure that California is doing everything that they can to protect our physicians, our nurses, and all members of the healthcare team. Many of us were drawn to careers in medicine because of the opportunity to truly help others. This is the work that we've been called to do. Now is our time. We're asking all medical professionals, physicians, nurses, physician assistants, and all members of the healthcare team to join us to take care of Californians through this surge. For many of us, that means stepping outside of our comfort zone and leaning into our inner strength. We're calling on the spirit of all healthcare workers across California to step up and help to serve the patients of our state. I've been humbled and deeply moved by the many stories of the physicians and others whose true selflessness has really led with compassion and heartwarming, caring solidarity through this. I know we're going to hear many, many, many more stories of this true humanity in the weeks to come. So thank you to all of you who've already worked long hours and who will continue to work tirelessly to help our patients. We truly appreciate you and thank you in advance for your continued courage and your service. And please reach out to the healthcore.ca.gov to sign up to be here for our patients and our communities. Thank you.
Thank you, Doctor. We're all struggling with the healthcore.ca.gov site, but we just got it up and operationalized it. Look, I want to just make this point. I'm very proud. You know, California has some of the, well, in fact, the highest standards of personal protection, long championed by the Medical Association, long championed by the California Nurses Association in terms of ratios, in terms of protective gear, and those are things that we are very, very proud of. And I recognize at this moment of anxiety, in order to meet this moment, we've got to temporarily suspend some components of some of the licensing and scope of practice as it relates to meeting the care needs of those Californians. And so it took a lot for those organizations to participate and step up. And I want to just thank them personally on behalf of millions of Californians. We're very grateful for your willingness to do so at this moment. And again, I'll remind you, this is temporary. This is not permanent. No games are being played. And we have deep admiration and respect for all of you and deep gratitude that you're willing to work with us to meet this moment. So with that, broad strokes, that's the call to action today to all California healthcare professionals to help participate and go on this site. And we look forward to any questions that anyone may have as well.
Katie Orr, KQED.
Governor, we understand that the California Department of Health won't release the total number of hospitalizations county by county. Is that a number that you have? Do you have the statewide number of hospitalizations? And if so, will you make that more publicly available, given how useful it is to track the disease?
Yeah, it's 1,432, as I said. That number substantially higher than the first number we gave you a couple of days ago, which was 746. As a consequence, roughly doubled in 4 days. And we'll provide more information on that as needed. The number of ICU beds today is at 597. You may recall 4 days ago it was at 200. So can't be more precise than that. We have a 19.9% increase overnight in the ICU bed capacity and a 14.3% overnight increase in the hospitalization capacity. As it relates to your very specific component of question, as it relates to the county level, we will provide that information. I'll make sure you get it.
Carla Marinucci, Politico.
Hi, Governor. Thanks for doing this. I have a two-part question. I hope that's okay. On the first one, we're 2 weeks into the Bay Area shelter-in-place orders, and California as a whole is faring better than a couple of other states, New York, New Jersey, Louisiana. Just your thoughts. Do you think that those orders have flattened the curve in the Bay Area, as some UCSF doctors suggested over the weekend? And my second question is on the school closures. We're 3 weeks into those, and some of the schools are providing instruction in different ways. Some are giving video classroom lessons. Others are pointing families to websites with worksheets. Does the state need to do more than just provide guidelines? And what do you think of the situations in which districts and teachers are engaged in disputes? So I hope that's okay, but two-part question.
Thanks. Let me talk about the schools. At 2 o'clock today, all 58 county superintendents are getting on the phone, and we'll have more detailed information to provide you after that conference call that goes deep into the issue, not only of distance learning, but special education and the issue related to food distribution. So that's the agenda today. And then a very sober conversation we're going to have about the expectations for the remainder of the school year. But the answer to your question is yes. We need to do more, and let me fill in the blanks based on the details that come out of that call this afternoon. And by the way, on Thursday, we have another webinar specifically related to distance learning for special needs kids as well, which only reinforces my affirmation that yes, we need to do more, and we are trying to do that in real time. As it relates to the bending of the curve, I'm not gonna, we're in the middle of this, and I think it would be too easy for us to assert a belief at this moment about what has or has not worked, except to say this: we know what does work, and that's physical distancing. And we believe very strongly the stay-at-home order has helped advance our efforts in reducing the stress on the system that we believe would have already materialized in more acute ways had we not advanced those protocols when we did. We have not been sitting around over the last week or two. We have been preparing over the last week or two, and that stay-at-home order has advanced that effort. It's bought us time to prepare. But I want to make this point. I made it from the outset. When you see a tripling of the ICU beds, when you see a doubling of hospitalizations just over a 4-day period, that's a point of not just consideration, it's a point of obvious concern as it relates to our ability to meet not only the physical needs of that service, but the personal protective equipment that is required of it, and obviously the human capital that we're speaking of today. And so I don't want to say that it's worked, but I will say I think we have benefited in terms of our capacity to prepare, but we're very sober about what these trend lines are looking, or at least instructing over the next couple weeks.
Adam Beam, Associated Press.
Governor, you mentioned you wanted to increase the number of medical workers by about 37,000. That just seems like a really large logistical challenge. I'm wondering how the state can go about doing that in a short amount of time. And do you know where they would go? Would they go to field hospitals or existing hospitals or both?
No, and thank you for the opportunity to clarify. That's just the universe of individuals that are retired or inactive licenses that we project are out there. So that's not the number that we're trying to bring in. That's the universe that we're trying to cull from. So we're looking for thousands and thousands of individuals. And again, it depends on the expertise. It depends on the specific skill set. And we're parsing those out throughout the system, working very collaboratively with our entire hospital system, as well as our skilled nursing facilities, our assisted living, congregate facilities, and the like. It's all part of this larger system. And so we're scoping a universe of 37,000, and those will break down in real time, and it's geographic, it's system by system, it's capacity that we're looking for. Let me be specific. When we open up the Sleep Train Center, it's capacity we're looking for when we open up these field medical stations. That capacity differentiates itself on needs. In Riverside, they may have certain needs. Santa Clara County has different needs. Counties can absorb more in these more resourced parts of the state. They can absorb less, so we have to supplement that in other parts of the state. So it's an iterative process, but the universe is 37,000, and thousands is the number that we hope in very real terms, in short order, will present themselves, and we can start making those matches.
Rachel Swan, SF Chronicle.
Hi, Governor. I just wanted to clarify again about this 37,000. Would the nursing students you mentioned, would they be granted provisional licenses to practice? And then what would happen after the pandemic is over? Would they go back to school, or what would happen?
Yeah, let me ask Dr. Galley to come up and can talk specifically about that.
Sure. So our goal is to recruit both retired and active folks, people who have part-time roles now who can increase their hours. And to your specific question about students, depending on where they are in their training, we're obviously looking to people who were near graduation and fulfilling their degrees. So many are not able to finish those last few months because schools are out because of the COVID-19 response. So who better than those folks who are really close to being done to bring into the workforce now, essentially continue their clinical training with the support of experienced nurses or other health professionals that are in the same line of work that they will be, and invite them into the work. And depending on where they were and how many months they are surging, we will have to work with our licensing boards to determine whether they've completed enough of their training to get fully licensed on an ongoing basis, or whether they need to return back to the classroom and their clinical rotations to finish up and get their license down the road.
Next question.
Angela Hart, Kaiser Health News.
Hey, Governor, thank you for taking our questions. We wanted to ask, so looking at your projections and the modeling that you all have done, when do they indicate that the state could be reaching the capacity in terms of the hospital beds needed? When could they be overwhelmed? Roughly, if you can't provide a specific date, when roughly would that happen? And then just one more thing to tail on the end of that is, we're wondering if the state's plans to expand capacity are being done in addition to what individual hospitals and hospital systems might be doing, or is it spearheading the across-the-board response?
Just on that, we are working hand in glove within the system. I'll remind you, roughly 75,000 licensed beds in the state of California. We requested a surge of the system, 50,000 beds, 30,000 of those a requirement within the hospital system themselves, which represents roughly a 40% surge. And so that's actively being advanced within the hospital.
Okay, sorry, it's kind of boring because I had on the press conference. I don't know if I said that at the beginning, but
And access and resource
so
additional capacity. As I said,
low thick,
part of that, all of
and I can't see, but I bet it's kind of gonna be light, like I'm whitish, like a ghost, and that's just because the lighting, I can't see that, but.
Corps of Engineers and others are looking towards are part of those 20,000. So that's an integrated strategy within and externally outside of that system, but all being coordinated through
All right.
folks here